It was back in the late 1990s, and I was working as a graduate student in the group of Dr. David Jenkins in Toronto. And I was working in the determination of glycemic index of foods. And I was reading the literature, the scientific literature, and I came across some key papers that were written by Ed Giovannucci at Harvard, Boston, and Gail McKeown-Eisen at the University of Toronto, where they were proposing that high blood glucose levels and high insulin levels, so hyperglycemia and hyperinsulinemia, were key factors for the development of colorectal cancer. And since I was very familiar with the glycemic index concept, I thought that low glycemic index foods, by their virtue of not raising blood glucose and insulin as much as high glycemic index foods, may have a different, potentially a different risk profile in cancer studies. So I proposed this project to the head of the epidemiology unit, Dr. Silvia Franceschi in Aviano, at the CRO of Aviano, this center, the oncologic center in Aviano. And she thought the topic was interesting and worth studying, so we did it together, and we used data from large Italian case control studies that she was conducting with the collaboration of Professor Carlo Lavecchia, Mario Negri Institute in Milan, who is also conducting large cancer studies. So that's how it started. I think we need definitely more studies in this area of looking at glycemic index and cancer risk. We need to also have look at studies that are clinical trials in this area of cancer risk and glycemic index, possibly looking at prevention, but as well as adjunct to treatment, of cancer treatment. And I believe that in terms of cancer prevention, so looking at the association of glycemic index with cancer risk, we need to focus a bit more on specific populations, looking at the importance or the potential role of ethnicity, of body weight, of sex. We, for example, noticed that there is an association between bread and cancer risk, colorectal and breast cancer risk in Italy. It's a positive association, so there is a greater risk of developing colorectal or breast cancer with high consumption of bread, which is a high glycemic index food, than with a low glycemic index food like pasta. But this association with bread and cancer was stronger in women, for example, than in men. And with breast cancer, the association was stronger in postmenopausal women than in premenopausal women. So there may be an important role of sex, but also of sex hormones. So I think this aspect needs to be studied a little bit more in depth.